Hello, I'm Dr. Wickham Simons. I'm an obesity medicine specialist in the Triangle area of North Carolina, and this is Obesity Medicine Perspective, an educational video series for patients and other healthcare providers who want to know more about how to treat the disease of obesity with diet and medications. At the last video we did, I was talking about the subject of fat and eliminating carbohydrates, and it's okay to eat fat. And if you've been to my practice, you know I'm teaching this. So that's great stuff. And prior to that, we put that in the context of insulin levels. So high insulin levels cause your body to store food as fat, and low insulin levels cause you to be a fat burner. And we want the latter. So we want you as a fat burner, not a fat storer. Now, in regards to those insulin levels, I get questions, hey, is there a medicine that I can take that's going to help me with this insulin level? And the answer is yes. So many of you know that at my practice, if you feel like your appetite is really out of control and you have a hard time controlling the amount and types of food you eat, that we do offer appetite suppressants. And the most common one we offer is phentermine. And a significant number of my patients take it, although not all of them. And so a lot of you are familiar with that drug. Now, there is a second drug that I will add to that very frequently that lowers your insulin level. The name of that drug is metformin. And metformin is a drug that classically is used in pre-diabetics to prevent them from becoming diabetics, and its mechanism of action is to lower your serum insulin level. And when this insulin level goes down, I've explained, you become a fat burner rather than a fat storer. So this is a cheap, inexpensive medication that has been around for a long, long time. It's not new to the market. It is well known, and we use a lot of it here in our practice. It will lower your insulin level, and it does not cause you negative effects in your blood sugar if your blood sugar is normal. And this is the beauty of this drug, is that it's not something a lot of people think it's just something that diabetics take to lower their blood sugar, and it's actually something that I think in this case is used to lower your insulin level without affecting your blood sugar. So I'm not giving it to you as a treatment for the disease diabetes. I'm giving it to you as the treatment of insulin resistance, which is a high insulin level. It is cheap and inexpensive. So 30-day supply for most people is about $10. We have it right here in the practice, and it can be taken in conjunction with the appetite suppressants that we use. There are some contraindications to it. The main one would be someone who his kidneys aren't functioning normally, and maybe they're going to need dialysis in the future, and we could, as providers, sort that out for you if you decide this drug may be right for you. And then two, it has one particular side effect that most patients need to know about. It will upset your stomach if you take it on an empty stomach. So when I say upset stomach, I mean like abdominal cramps and diarrhea. So the way that people take it is at the end of their largest meal of the day. And if you take it on a full stomach, it's very unlikely to cause this. It doesn't have a lot of adverse other side effects that make you feel bad in any way. And so it's kind of simple, it's cheap, and it has a low side effect profile, and it's very effective in conjunction with an appetite suppressant and with a diet that is restricting carbohydrate. That diet's going to lower your insulin level. This medicine's going to lower your insulin level. And what happens as a result is you lose weight faster, and you lose body fat faster, and you preserve your lean mass while doing it. You can track all of that in real time by getting the InBody 770 body composition analysis test done. That test will tell you exactly how much body fat you have with precision, where it's located. The same is true of lean mass. It does that also for lean mass. So if you really want to know these things with precision, that's the test to have done when you're here at the office. And it's simple and easy to do. We're going to give away a lot of these tests. If you'll follow us on the Dr. Simon's Weight Loss Facebook page and on our Twitter feed, we'll give you the information on how to register for free tests. And we want you to follow us there. So until next time, I'll give you the information, you give me the effort, and together we'll overcome obesity.